Hi everyone, my name is Sarah. I am one of Dr. Wright's nurses at the Laser Lipo and Vein Center, and we're doing some short videos just to help reiterate information that you guys receive at either your pre-op appointment or your post-op appointment, and these will be available to you through YouTube, on our website, just so that you have something to go back and look back on. I have done a video on preoperative information, so please go check that out. Right now, what we're going to talk about is postoperative information. And Amanda's going to start asking me some frequently asked questions.
Okay, Sarah, when would my first follow-up visit be after my procedure?
So we generally do your first postoperative appointment at 2 to 4 days post-op. We can always tailor that to the patient and things that are going on. Obviously, if we need to see you sooner, we can. If we need to push it out a few days, we can do that as well. But we generally like to see people between 2 and 4 days post-op.
What will all happen during my post-op appointment?
So at your post-op appointment, it's a lot of fun. You are going to come in and remember, you know, the first few days after surgery, you're going to be sore, you're going to be swollen, you're going to be tender. You may still be draining some of the blood-tinged tumescent fluid. So we're going to have you take your compression off. We're going to do measurements again. We're going to do some follow-up pictures. A lot of people do feel kind of weak and nauseated at this appointment. So if you need fluids, we can give you some IV fluids. If you need some medication for the nausea, we can do that as well. We're going to talk about how long you need to wear your compression. We're going to talk about medications that you may need to start post-operatively as far as like our lipedema patients. So there's a lot of information going into our post-operative appointment, but just remember, we're going to have this video available to you, and we're also giving you a handout with the information on it as well.
What medications do I continue to take after surgery?
So after surgery, it's going to be very, very important for you to continue taking your antibiotic, any medications that your primary care physician has prescribed for you, you continue taking those. You have pain medication available to you. You can take just extra strength Tylenol if that works for you. You will not take ibuprofen for about 5 to 7 days after surgery if that's something that you're going to switch over to. What you're not going to take, most people do not need to continue taking their Ativan, which is the anti-anxiety medication, nor will they need to take any of the pain medication that they received during surgery.
How long will I be in compression for after surgery?
So most everyone is in compression for a full 8 weeks after surgery. It is very important for you to be in this compression in order to get the best results possible.
When will I return to work?
Most people can return to work, within a few days of having surgery. Everybody is very different on that too. It's what you're tolerating, if you're still draining, how you're feeling. We do have some patients take a week off of work just to kind of get used to having to wear compression and things like that. But there really is no stipulation on when you can return to work. That's all preference.
When can I return to my normal exercise routine?
That's kind of the same deal. You are going to gradually add back in exercise into your routine. You don't want to go hard right at first, because you will increase your swelling. You're going to want to keep your compression on during any type of workout activity. Walking is great, but just remember to slowly add it back in, and your body's going to tell you whether or not you're doing too much.
When will my draining stop, and when will these addits fade?
So normally draining occurs for 2 to 4 days. At least the most of it happens at that time. It can continue up to a week. Some can drain even longer than that, but the majority of your draining is going to happen in the first few days, and it's a lot of draining. I'm not going to kid you with that.
And then when will my addits fade? Do you give me anything to put on them?
So at your post-operative appointment, I'm going to give you calmoseptine, which you're going to put onto the added sites once they have scabbed over. They are left open to drain, which is a good thing for that draining to happen. The calmoseptine will help those scabs heal a little bit nicer, but sometimes it can take months for those added sites to fade off and go away, but you need to take care of them as well, and that includes putting on sunscreen and keeping out of the sun.
When will I see my final results?
That is different for everyone as well. Some people come in at their first follow-up appointment and they see amazing results. Some people, it takes longer. It may take a couple weeks, a couple of months, 6 months, maybe even a full year. Swelling is different for everyone, but for the most part, people see results around their first couple of follow-up visits.